uses a blend of integrative and traditional medicine whose goal is to optimize your lifestyle, nutrition, exercise, and sleep to promote the best possible health practice philosophy. Green Medicine believes in an individual one-on-one approach to medicine, as there is no one-size-fits-all. His program is tailor-made and handcrafted to an individual's needs. Initial appointments are usually 2 hours long. Questions are encouraged in every effort made to give you a complete understanding of your conditions and treatment. A strong emphasis is placed on healthy lifestyle rather than medication, although we realize that medication is needed. Dr. Green began his medical career in 1980 as chief of microbiology, immunology, and virology in an 800-bed Midwestern hospital. He then completed med school at the University of Iowa. I'm from Iowa. And followed it with a residency in family practice. Family practice was chosen because it deals with the whole individual. Becoming disillusioned with corporate medicine and its emphasis on treating disease rather than promoting healthy lifestyle, he has continued to seek further education. This has led to board certification in not only family practice, but integrative and holistic medicine, anti-aging, and functional medicine. He is also trained in medical acupuncture and is a Reiki master. Dr. Green is a Lyme literate physician and a member of iLabs. He has helped many people suffering from Lyme disease and the co-infections that typically come with it regain an active, productive lifestyle. And without further ado, Dr. Green.
Well, thank you. And thank you for coming, and good afternoon.
Hi.
How did most of you know I put ticks on all of these front chairs? It looks like Bob's the only one brave enough to, With this size group, we can keep it really informal today, and questions, let me get a little run on this, and then we'll have plenty of time for questions. It'll probably go pretty quickly with a group this size, what I have to say. I'm going to talk a little bit about Lyme, the symptoms, the diagnosis, but then I'm going to talk about some new things. The last 3 months I've just been to iLabs, which I think most of you know what that means. If you don't, raise your hand. If I'm ever saying anything you don't know, just raise your hand.
Are they associated with the CDC at all?
No.
I didn't think so, but.
No, almost at odds with the CDC. So, yeah. And Lyme Disease Association, and then the American Academy of Anti-Aging too. And they're starting with some little pushing. They're starting to get into the Lyme arena a little bit. So, how many in the room have Lyme? How many in the room have Lyme and don't know they have Lyme yet? It's probably the rest of you. Well, Lyme has been around for a long time. Do you remember hearing about Otzi? And Otzi was the Iceman that was frozen, the mummy they found frozen in the glacier that was, they figure he lived about 3200 BCE. Guess what? He had Lyme disease. And they've also found Lyme in a tick in amber that's 15 million years old. So I know there's a lot of conspiracy theories about Plum Island and whatnot. I'm a microbiologist, I'm not buying it. That would not be my weapon of choice. If I was going to weaponize something, it wouldn't be Lyme disease. So I'm not buying some of those conspiracy theories. And it's been around 5 million years before we got on the planet and started walking around. So it's been here a long time. So it's probably going to be here long after we're gone too.
Hasn't it progressed to be much more difficult to treat as far as the...
I don't think it's gotten much more difficult to treat, but it's definitely spread and progressed with our population and with changing our, it's spread, and I'll go there a little bit. We think one of the reasons it's spread is because with urban sprawl, we cut down the forest. The first blood meal of a lot of these ticks is a little furry animal, usually a rabbit or most often a mouse. And that's where they pick up the Lyme disease, because other ticks have been feeding on them, and they're perfect. They're right down there at ground level. And we're chasing out all the things that eat little furry things, like raptors and foxes and, the mice and the raccoons and the rabbits can live anywhere, right here, right outside this building. But the foxes probably aren't going to be here. And there's a lot of coyotes, but I don't think they're quite as hard on the mouse population. So I think that's one of the reasons that's contributed to the spread. But when you're dealing with Lyme, there's a lot of controversy and a lot of misinformation. And a lot of doctors think, well, if you come in, we'll give you 2 weeks of doxycycline and you'll be fine. You're cured, as a matter of fact. That's what they'll tell you. I don't ever tell anyone they're cured, and if any doctor ever tells you you're cured, I would be probably looking for a different doctor, because we really don't know if we can cure this disease once you've had it, especially once you've had it more than 6 months. All I will say is you're in remission, or you've graduated from my program, and we might see you again, or we might not. But we have to deal with Lyme, and Lyme, unfortunately, almost always comes with co-infections. And the list of those just keeps getting bigger and bigger and bigger. And Babesia, Anaplasma, ehrlichiosis, Bartonella, Q fever, Mycoplasma, Rocky Mountain spotted fever, a whole host of viruses, Epstein-Barr virus, Powassan virus, Heartland virus, Bourbon virus, West Nile virus, some encephalitis viruses, parasites, different chlamydias. Tularemia is starting to make its comeback. That was one thing when I was getting an advanced degree in microbiology. I worked with tularemia, but hasn't been very big. It's coming back, and we talked a lot about tularemia this year at ILATS. And that's usually in rabbits, mostly in rabbits. So if you see a sick rabbit, don't pick it up. Trust me, it's very contagious. Parasites and even yeast, brucellosis and typhus. So that's really what I'm looking at when a Lyme patient comes in. It's not like, well, we have to treat Lyme. I call it Lyme complex. Some people call it MSIDS. There's a lot of different terminology for it, but it's not just Lyme that needs to be treated. I get a lot of questions about transmission. I'm not sure we're even sure about all of the ways that Lyme is transmitted yet. Ticks, probably the number one, okay, by far. Maternal fetal is definitely, if you have it and you're pregnant, it's probably close to 100% chance that you're gonna pass that on. There's now one species of Lyme that is transovarian, meaning that if you have it, your eggs will probably be infected with it. So that's automatic transmission. Blood transfusions, maybe Lyme, for sure Bartonella, and for sure Babesia. We know those. And I don't, if we said everybody that's been exposed to Lyme can't give blood in Wisconsin, we'd all die, okay? Because I'm sure darn near everybody out there that's giving blood probably has Lyme or been exposed to Lyme, and they don't even know it. Sexual transmission, I get a lot of questions about that. Lyme has been recovered from every bodily secretion that there is, including semen and vaginal secretions. So we really think that it happens, and I'm sure it does. Now, most Lyme docs don't think it happens very often. And my take on that from a microbiology standpoint, and having run a microbiology lab and having dealt a lot with sexually transmitted diseases, is that when you're in a stable relationship, you are swapping bacteria on a regular basis. You're licking his ice cream cone, he's taking a drink out of your water glass, et cetera, et cetera. So, trying not to get too graphic here. But I think over time you get immunized against each other, and your own flora, your bacteriologic mix in your house is different than anybody else's house. But ours in this area is different than in Missouri, is different than in Mexico, so. But ticks have their own flora too, so that the mix of infections we see here is a little different than they see in New York. But I think that's why we don't see a lot of sexual transmission in a stable relationship, is because you've usually been together for a while and you're kind of immunized against each other. But it certainly can happen. Biting insects. Was proved 2 years ago that rickettsia, which is Rocky Mountain spotted fever, can be transmitted by mosquitoes. They've recovered it from mosquitoes. I have at least one patient who's pretty darn sure they got it from mosquitoes, and it was a 6-year-old baby. Their parents were pretty sure, and that baby was tested at birth. and only started to exhibit symptoms after, and was negative at birth, and at 6 months of age, after a really bad reaction to a number of mosquito bites, developed the symptoms of Lyme and tested positive. So we think that happens. It's not been proven yet, but horseflies, deer flies, any biting insect potentially might be a vector. And I just learned this year that intradermal transmission of Bartonella occurs. And that's if a biting insect is feeding on you and defecates on your skin, that can transmit Bartonella. So it's out there. This year I've had 13 of my patients get reinfected. Last year I had about the same number. Yeah, and it gets discouraging sometimes.
How do you know they got reinfected?
They know right away when they get reinfected.
Symptoms are showing up right away?
The symptoms generally show up fairly quickly, and people that have been through this, I don't care if you're 90 and you have dementia, you have so much cellular memory of these symptoms that you will know right away. I had a 22-year-old college sophomore who goes to school in southern Missouri as one of my patients, and I saw her this fall. I expected her to be graduating, when I call graduating. She was feeling great. Last time I saw her, all of her Lyme symptoms were gone. This was one final checkup, and she came in and said, well, I got back to school about 2 weeks early, and we went for one hike in the woods. And she came back, she took a shower, she did a tick check, she did everything right, no problems. 2 days later, when she went back in the shower, she found a deer tick right here on her chest that was embedded. Within a week, all her symptoms were coming back. And they came back gangbusters.
Yeah, but I mean, it seems that if you have Lyme, these symptoms come and go in various ways or force.
Well, this is
Why
treated people. This is treated people, okay? People basically in remission. So,
Yeah, but I mean, you can be in remission and for some reason, something is triggered in your body that kicks it.
absolutely, absolutely. But almost all of these cases, they've run into a tick. They had a tick bite. They had a known tick on them. So, almost every one. So, but you certainly can have exacerbations and remissions, and even, that's why I don't say anybody's cured. Even if, you're feeling great, go out. I see a lot of people coming back a year or two down the road.
So you're gonna be busy forever.
Well, that's unfortunately, we need more docs out there. Symptoms, I think I'll just go through some of those briefly, and I have a sheet. If you have friends that go, so you got this Lyme thing, huh? Well, that's too bad for you, that sucks, and you watch them, and I tell all my patients before we're done treatment, they will know more about Lyme than about 95% of the doctors out there, which I'm sure 95% of the doctors would be very insulted, but I used to teach medical school. I used to teach infectious disease, and I taught wrong. So I know what they're taught, but just, grab one of these and have them fill it out. And this is almost how I make the diagnosis of Lyme disease. We'll talk about testing, but if you go to the CDC website, and they've changed it over the years, and it keeps getting smaller and smaller, but fortunately I've printed this off, but they said, Lyme disease is diagnosed based on signs and symptoms and a history of possible exposure. Well, here's the signs and symptoms, and you live in Wisconsin, so, it doesn't take too much to put those two together. And then it says laboratory testing can be helpful if used correctly. Unfortunately, most of the time it's not used correctly. And you go in, and as you were alluding to, the flip of the quarter is better than the majority of the Lyme testing out there. And my quarter is 50% accurate. It's always been 50% accurate. I'm not giving that quarter away, by the way. I'm gonna keep it, so, But pain, fatigue, I see a lot of cognitive issues. I see a lot of anxiety, depression, panic attacks in people who don't have symptoms of that in a prior life before Lyme. Photophobia, phonophobia, noise bothering you, bright lights bothering you, fevers, edema, especially one-sided, where my right knee swells up, on my left one is fine, or my right ankle swells up. Fevers, Bell's palsy. The longer I do this, I'm becoming fairly well convinced that Bell's palsy is probably mostly Lyme disease, if not all. And I've treated Bell's palsy for years, nobody knows how to treat it. And we think it's herpes virus, we're not really sure. Well, I'm telling you, it's really very, very common with Lyme, and Lyme might be the cause of it. Myocarditis, endocarditis. About, I think 2 years ago, the chief of oncology at Duke University, Dr. Spencer, with all the bright, best doctors, with all the resources, was getting sicker and sicker and sicker, and then finally died, or his heart died, more appropriately. Fortunately, they found a new one for him and put it in, and no one knew what happened to him, why all these doctors couldn't figure it out. And when they looked at his heart, it's like, holy cow, it's full of Lyme disease. And everybody at Duke University missed it. So now he has joined our camp in saying that, we're not doing a very good job with Lyme disease, and we really ought to be looking at this like cancer, because it's at least as common, if not more. 30,000 cases a year are reported. I've had a ton of my cases denied by the state, saying, well, that's not enough evidence to call it Lyme, so we're not going to count this case. By the CDC's own estimate, looking at things other than testing, they think there is between 300,000, which is what they reported their study said, but their study actually said between 1 million and 300,000 cases, new cases every year. That makes it more common than breast cancer, that makes it 6 times more common than AIDS. That's pretty incredible statistic. And then one of the problems is, you look great. I mean, people, you say, well, come on, go with us. Well, I really don't feel like it. Oh, come on, just do it. You look great. They can't see inside of you, and a lot of Lyme patients get labeled as drug seekers, as depressed. Well, if you're female, you're automatically born with a Prozac deficiency in this country. Every doctor knows that. Okay? So we just treat you with Prozac and everything will get better. So, and I see a lot of that. To diagnose it, the lab actually supports, the only thing I use the lab for is to support my clinical diagnosis, and probably to keep me out of trouble, because I'm treating somebody that's really a disease with a clinical diagnosis, but the state doesn't believe that. You're supposed to have the 2-tiered testing on everybody, which you're right in alluding to. It's actually very, very poor sensitivity. The ELISA is the worst test you can do for Lyme. And that's where they start out. So that misses a huge number, already. And in 10 to 20% of the Lyme patients have Borrelia miyamotoi, which will be negative on Western blot, on PCR, on ELISA. So you're going to be missing those people automatically. There are a number of tests. This group, they've talked to you about the test before, so I'm not going to go into that very much. I was a little disappointed this year. One of the things I wanted to get from iLads was new testing that's available. And there's some things out there, but there's really not that much that's really that good right now. And there's some very expensive tests. There is a culture, which is the gold standard, but it's $600. So,
Dr. Bright's art, at North Carolina State, isn't he the person that, or is that just for PART1?
I'm not familiar with him. So,
Yeah, he's supposed to be an expert on Dick and PART1.
Okay.
Even he says it's not 100%.
yeah, and well, there's no 100% with this, except culture. I mean, if you get it, it's pretty hard to deny that you have it if you can grow it.
Yeah.
Yes, ma'am.
I had heard, I think it's in Pennsylvania, a young professional created a lap stick to use on the urine of someone with Lyme, and it sees the Lyme antigen,
Mm-hmm.
so you get a positive or negative, and it's there, and it's really good. But for some reason, Pennsylvania's not letting it go. I heard that on Katrina Macras.
I've heard that too. I've not.
I've read it before too, yeah.
And there are some things. Some of the states are extremely restrictive. IGeneX, which is who I use for the majority. And they're probably one of the best, they're the,
Yeah,
as
yeah.
far as I'm aware of, they're the only lab that scored 100% on their government proficiency testing for Lyme. Even though a lot of docs go, well, you know, that's a bad lab. No, they're really not. They're a really very good lab. They're not FDA approved. Well, they don't have to be FDA approved. They only have to be FDA approved if they're gonna sell that test to somebody else. And they don't tend to do that. And I've had patients go to Mayo, and I did work at Mayo when I was in grad school for a while. Of course, they throw everybody else's test out and do their own, which is one of the worst tests in the country, notoriously. And I've had them put in writing, this patient does not have Lyme disease. I think that's a pretty bad thing to do, to tell you the truth. So, and all of the patients that I've seen that have gone to Mayo with Lyme disease have not come out with good experiences. They do some things very well. My opinion is they don't do Lyme very well at Mayo. When you're looking at the diagnosis, a lot of people have had some prior antibiotics, and maybe appropriate antibiotics, maybe not, but that can affect the results of the test. A lot have had steroids because they've got joint aches, and when a doc doesn't know what to do, most often they throw steroids at it, because usually steroids make everything better. Unfortunately with Lyme, it makes it, you can make it very much worse, okay? And if someone has had steroids, it makes my job a lot harder to try and treat the Lyme. It just is like going up to the prison and saying, well, here's the keys, guys, there's town, go have fun, we're going on break. It really lets Lyme take off and go. There is some new technology out there, nano traps they're called, and the nanotechnology has a lot of hope for the future, and nano means very, very tiny. And some of these, it's kind of hard for me to even fathom, but it's kind of like setting a mousetrap out with a cheese. The bait, you know, the mice will go for the cheese and get caught in the trap. These nano traps attract antigens, so you can increase the sensitivity of tests. And a lot of people, the antigen can vary a lot, i.e. the Lyme bacteria is what I'm talking about, can vary a lot in any blood specimen. So if you have a way to concentrate that antigen, those bacteria, you can make your test a lot more sensitive. And I think that's a technology on the urine test that we were talking about a little bit earlier. So there's some exciting things that are coming, but they're not here yet. And unfortunately, the state only is going to recognize so much, and right now, most docs kind of have to stick with that. Therapy. I use antibiotics, herbs, homeopathics, diet, exercise, sleep, detoxification, and a new IV treatment that I have, which I'll be talking about in a little bit, which is light treatment actually. It's still investigational, it's still under study, but it has been the best thing that I've found in 35 years of doing medicine. It's absolutely incredible. And for then a lot more than Lyme. It's actually something old that's been brought back. If there,
What does it involve? I mean, as far as-
I'll talk about that in a little bit, okay? I'll spend some time on that because that's brand new. Therapy is usually, my average is 18 months. If I go conventional therapy, if I go the light therapy that I'm talking about, I've seen some people in 6 months that are doing much better, or even shorter. But it's a different paradigm than you're used to. It's not like a urinary tract infection where you come in, I might give you one antibiotic, one time, and now you're gonna be fine. This is difficult because of so many things we have to treat. And Lyme, even if you were lucky enough, so to speak, just to get Lyme, I mean, there's cysts, there's biofilm we have to deal with, there's 5 or 6 forms of Lyme in your body that I have to deal with. And I tell my patients, you know, they come in, well, they convince their doctor to give them 2 weeks of doxycycline or 21 days of doxycycline, finally, after complaining for 2 years, that they don't feel good. And my analogy is, well, that's like taking anyone here and putting you outside this building in your swimsuit right now, and just waiting. And I'm betting that almost everybody in this room, if not everybody, is gonna go, this sucks, this is not Jamaica, and they're gonna change their environment very quickly. They're probably gonna beat me back inside the library, okay? Well, Lyme is the same way. When you give doxycycline to Lyme that's established, it just goes, well, this sucks, I don't like this, I'm just gonna form a cyst, and I'm gonna sit there until that doxycycline goes away, because I'm patient, and it will go away. And then in a month or two, it just goes back into a vegetative state. At which point you go back to your doctor and say, well, it didn't work, and your doctor says, well, it can't be Lyme because you're cured. So here's more Prozac, okay? So all of the forms of Lyme have to be treated. And there's antibiotics, there's herbs. Some of the alternative therapies out there, ozone, being used. Some people are having a fair degree of success with it. I don't use that. I could, but I don't. I don't think the delivery methods are down. And I've had a number of patients that have had ozone therapy. I personally just haven't seen it work that well. I just don't think they've got the delivery down to get a gas inside the human body and get it everywhere. There's hyperbaric. I'm a hyperbaric doc. I ran hyperbaric altitude and dive chambers in the Air Force. I'm hyperbaric trained. I worked somewhere where we had a hyperbaric chamber. 10% maybe responded to the hyperbaric, and it's very expensive. And I think with Lyme treatment, and you will see this out there, it's very common, there is no one size fits all. And one thing may work, Rife machines may work for you. And boy, if they work for you when you've been suffering, now you're an evangelist, you get very evangelistic and say, everybody needs to use Rife machines, because boy, it really works like, well, you know what? It probably doesn't work for everybody. And it's the same way with everything, and you read, there's books and books and books, you know, cure your Lyme by doing this. And I wish there was a this. It's like you go into Walgreens and there's 50 different things for colds. Why is there 50 different things for colds? Because none of them worked. If something worked, there'd be one thing for colds, okay? So
Just a question on hyperbaric. So you're saying people that go through the hyperbaric process, only 10% actually create holes?
that's about my experience.
And
Yep.
you spent $20,000.
And you certainly can, and well, whoops, it didn't work for you. There's hydrogen peroxide IV. I think that has potential. You got a little tricky. There's silver IV, which I am told is very good, and that's colloidal silver intravenously. It's a little touchy. If the Herx doesn't kill you, you might make it. There's hyperthermia. You can't get that in this country. You have to go to Germany, and that's just, it's flowing around. All the Lyme letter doctors have our own little network that we communicate. If somebody has a question, hey, I've got this patient with this, everybody in the country takes a shot at it. Hyperthermia was just banding around there, and the consensus was, well, you have to go to Germany, it's very expensive, and what they do is they take you into an operating room and they run your core temperature up to about 100 plus, 105, 106 degrees, and leave you there for several hours, which is kind of dangerous. They've got to monitor you very closely, and think about how you felt the last time you had a temperature of 105. You don't feel very good, but the consensus is that you come out of there feeling pretty darn good for about 3 months, and then guess what? So it might treat Lyme, but it doesn't treat the co-infections very well, apparently. So there's not a magic bullet there. There's my IV therapy that I have, and what this IV therapy consists of, it's called UVLRX, and their website is uvlrx.com. And it's old therapy that actually started looking at this in the 1890s. And it was used extensively in the 20s and the 30s and the 40s for about everything, including envenomations like rattlesnake bites and rabies. And I've not found any success rates on how successful they were with rattlesnake and rabies, but I know the theory of why it works for that. But they were enormously serious. and successful in taking patients that everybody else had given up on, like septic abortions, bad septicemias, which is bacteria in your blood. And back then, without antibiotics, that was it. I mean, you were a goner. If you had some retained placenta that got infected or something and you got septic from that, you're gone. If you had a bad pneumonia, you probably died. And they were virtually close to 100% successful in turning these patients around. Cancers, they were having really good luck with. And so they had this inexpensive, very good technology that worked very well, that caused no bad side effects, and then one thing happened. Penicillin. And penicillin came drug companies. And they actually ran this out of business. And actually got the AMA on their side, and I learned that there was actually a congressional investigation. The Congress investigated the AMA and found them, they used a lot of really bad adjectives for the FAA, including bought off, among other things. Found it absolutely unfounded that they said there's no research, there's a lot of research. This technique has continued in Europe, and there are some other providers in the state, and I think you mentioned Dr. Waters. I didn't realize he had this, but the older technique is you take out a portion of blood, usually no more than about 50 milliliters. You treat it with IV or UV light, and then you put it back in the body. That was a lot more common before AIDS, and then when AIDS came out, everybody got a little bit nervous about having something taken out of their body, manipulated, and put back in their body, even though it was their blood, and you have to anticoagulate it. You're treating a small portion of the blood. So a lot of docs that were doing that, and I've talked to some, and that's a valid technique. They were having pretty good luck with it, but most stopped doing it because of people's fears. Our technique is we insert a 20 gauge IV catheter, and then in that catheter we put a fiber optic light catheter. So there's no medicine. We do hook up a saline bag, so you get about 200 cc's or milliliters of saline over an hour, and each treatment is an hour. But during that hour, it's like putting a flashlight right inside your blood vessel. So, and that treats in an hour. They figure that's about 150% of the blood that it treats. So it's hitting probably darn near every red blood cell that you have in circulation. And it treats it with red light, green light, and ultraviolet A. And you go, well, what can that do? Okay. Well, actually it does quite a bit. And it, first of all, quadruples ATP or energy production. It decreases inflammatory markers, and that's well established with research and measurable. It revs up your immune system, it activates your immune system, which very good things happen in just about anything that's wrong with you when you decrease inflammation and you increase your immune system. And my whole point of all of my patients, my number one goal, they might be there to get their Lyme treated, I'm there to get their inflammation down. Because inflammation is really the root of all evil. And if I can get that down, we take care of just about everything else. So, and the UVA helps sterilize the blood. And ultraviolet light is used in hospitals. You can go buy something for your toothbrush to put in that sterilizes it every night that's ultraviolet. I've got a little deal that you go over to REI and buy, that you take some river water and you put it in there and hit the light, hit the switch, and it's 30 seconds of ultraviolet light in that water, and you can drink it. It won't take pesticides out, but anything living it will take out: parasites, bacteria, viruses.
Is that a one-time shot?
No, you use it over and over and over.
Yeah, but I mean, as far as the typical patient, does it have to?
No. And we're seeing phenomenal results with it. And it actually turns out the research that they did, and I think this is actually how they discovered it. This was back in the 20s and 30s and 40s. People thought that, well, the ultraviolet did most of the killing of the bacteria. And they drew somebody's blood after a treatment, and they set it on some x-ray film, and it fogged the film. And they were like, well, that's kind of strange, because if we draw any of your blood and we put it on x-ray film with a tube on an unexposed film, it's not gonna do anything. And they found out that all of the cells